Hello, I'm Susie. I'm a lead practitioner for awareness with Devon Carers. We're an organisation that supports unpaid carers like you to maintain their own health, well-being and independence and to care confidently, safely and effectively. We provide a range of services to over 20,000 carers across Devon, excluding Plymouth and Torbay. Many of our staff and volunteers are carers or ex-carers, and we're able to understand the unique challenges that can often go hand in hand with caring. You are a carer and we'd like to make you aware of the services we have to support you during this time. No matter who you're caring for and whether they have the same condition as someone else, your situation is unique to you. Adjustments are made to some services due to COVID-19 in order to ensure our services and support continue. Our website provides a great range of information, including signposting to relevant organisations in your area here in North Devon, details of support groups and events in your area, and plenty of reference material. There's updates regarding support and services during coronavirus, and there's also a web chat facility so you can talk to an advisor online. We have a quarterly magazine which is a great source of communication about what's happening in your area and across Devon. It's full of news, advice and also advertises our training courses. Contributions from carers are always welcome, and it also gives lists about the training that we have available at that time. A whole range of courses enable carers to develop new skills and knowledge to help them feel more confident in their caring role. Courses are available online and face-to-face, and our training team are always pleased to hear from you if you've got a specific request for training that would help you with your caring duties. All our training courses are free. Carers often worry what might happen to the person they care for should something happen unexpectedly to them. Our alert card is designed to identify someone as a carer, so if you are unable to inform people that someone is dependent on them, the card will be used to alert a 24-hour emergency call centre that the cared for person may need help. It's been agreed with Devon and Cornwall Police that they will recognise the Devon Carers alert card as identification for being an unpaid carer. The card is free and it's best kept in a safe yet accessible place. Please get in touch with us either by telephone or online to apply for a card. You need to provide us with information about yourself and the person you care for, as well as up to 3 people who can take your place in an emergency. All information supplied to us will be treated as confidential and only accessed in case of an emergency. The Pod is an online community for interaction with other carers as well as professionals. We have a helpline, and our advisors can offer information, support and advice, as well as triaging for carers for further support with our local teams. Calls to 03 numbers cost no more than calls to geographic numbers and must be included in inclusive minutes and discount schemes in the same way. Calls from landlines and mobiles are included in free call plans. If you don't have a free call plan, normal call charges will apply, so please check with your service provider for details. Information from Carers UK states that 8 in 10 people caring say they have felt lonely or isolated. Our peer support team support you to meet and make friends with other carers, providing each other with mutual support and understanding. New friendships have shown to improve the well-being of carers by increasing their sense of connection to others. Our peer support team also runs support groups, enabling carers to meet up, share experiences and tips on caring, as well as the chance to learn new skills in a group. Time for You is our sitting service. We work with providers from the voluntary sector, the third sector and community partners to deliver a low-cost sitting service by providing volunteers to spend time with your loved one whilst you take time out. Benefits of the service are that you have a chance to get out to attend appointments for you, social clubs or to just sit and have a coffee with friends. The person you're caring for gets the chance to meet new people and spend time chatting with someone different. You can go direct to one of the providers shown on our website and make your own arrangements. No formal assessment is needed, and the service could be a regular arrangement between a couple of hours a week or something a little more ad hoc. You pay the provider just £5 per hour for each hour of sitting provided. A waiting list is currently running in readiness for the service to resume in line with the government guidance. Having a plan for anything unexpected and emergency is important for carers. Our What If emergency plan prompts you to record useful information that may be needed during an emergency. The emergency plan is a record that contains your basic useful information to help others when looking after the person or persons that you care for. It includes details of pre-arranged support from statutory or private agencies, as well as information regarding regular services you may use. Visit our website to print out the sheets you need to complete and use them to record the information you wish to be known to help others if you are no longer able to care. If you have no access to the internet or family who can help, contact our helpline to request a copy of the plan on 03456 434 435. Most importantly, store your plan at home and let key people know where it is. Choose a place that's easy to find and don't move it from there. For either a carer or the person you care for, a spell in hospital can cause additional stress and challenges in the weeks following discharge. We have a hospital services team who are dedicated and able to offer support during that time. Our hospital services team offer additional help to family, friends and unpaid carers when you or the person you care for has been in hospital or in a situation where they would normally have been admitted to hospital. This hasn't happened due to COVID-19 restrictions. We have hospital liaison workers who will keep in contact with those who are looking after someone in the 6 weeks following discharge. They will provide information, advice and support. Family and friends will also be able to talk to the hospital liaison worker about anything that is getting on top of them, including day-to-day tasks, and the worker will be able to look for solutions to ease this stress or strain. They can also support with practical help where needed and can help liaise with health and social care staff. Anyone can self-refer via our helpline or via our email address. Alternatively, you can be referred by a health or social care professional. A carers assessment is a conversation between you and one of our team. We refer to it as a health and wellbeing check. The assessment will look at how caring affects your own life. It looks at many areas, including, for example, physical, mental and emotional wellbeing, ability to access work and recreation. The assessment's for you. It's not an assessment of your ability to care. It's largely focused on the impact that caring has on you. No one will tell you what to do as a result of any issues identified during the assessment. Instead, you'll be helped to decide what you want to achieve and the support you might need to make any changes. A key part of the assessment explores whether you are willing to continue to care and also looks at whether you're happy with any support provided. It also explores your feelings and choices around your caring role. At the end of the assessment, a plan is created with you that looks at ways in which any needs you may have can possibly be met. Please do contact us. We're here to help. We look forward to hearing from you and we'll do our very best to support you at this time. Thank you.